Welcome to the webinar, Tag in Action, Minnesota Plays Tag, supported by the U.S. Office of Adolescent Health. The Successful Strategies for Improving Adolescent Health webinar series is sponsored by the HHS Office of Adolescent Health. This webinar is one of a series highlighting local, state, and national efforts to improve adolescent health and is part of a national call to action called Adolescent Health Think, Act, Grow, or TAG. My name is Evelyn Kapler. As Director of the Office of Adolescent Health, or OAH, I'm very pleased to be with you to talk about TAG and to share information about a successful strategy to improve adolescent health. This webinar highlights some exciting efforts to support adolescent health throughout the state of Minnesota. Today, we're joined by Julie Nietzel Carr, State Adolescent Health Coordinator at the Minnesota Department of Health. Before I turn it over to Julie, I'd like to provide you with an overview of OAH and TAG. The Office of Adolescent Health is located in the U.S. Department of Health and Human Services. The office was first funded in 2010 and charged by Congress with developing a national plan for improving adolescent health. OAH has used its limited resources and the input of experts to synthesize what we know about what works and to spur action in support of adolescent health. The TAG call to action is a first response to that charge. With this webinar, we're pleased to share an example of how the Minnesota Department of Health has engaged communities, young people, and adolescent health stakeholders in the development of an actionable adolescent health plan that will touch the lives of young people throughout the state. Julie will also share how this effort was informed by and aligns with our national call to action, TAG. TAG builds on the collective work and insights from many professionals, researchers, and family members who know what it takes to promote the health and healthy development of America's 42 million adolescents. Teens are generally fairly healthy, yet there are many missed opportunities to promote adolescent health and to intervene promptly as challenging health issues emerge in adolescence and young adulthood. TAG is a comprehensive, strengths-based, positive youth development approach to adolescent health rather than a risk-based approach. TAG is designed to help young people reach their full potential as healthy, productive adults. With TAG, we hope to spur action across multiple groups of professionals and organizations, and in communities that all share a common interest in promoting adolescent health. Stakeholder engagement is a core tenet that drives all aspects of TAG and reflects our understanding that many determinants of adolescent health lie outside the healthcare system. The goals for TAG are the following: to raise awareness about health, to engage stakeholders, including youth-serving organizations and caring adults, to get adolescent health on the national agenda, and to spur action. Long-term, TAG contributes to achieving the Healthy People 2020 objectives for adolescent health developed by HHS. More details about TAG and the 5 essentials for healthy adolescents can be found on the Office of Adolescent Health website. Also, before we begin, we'd like to point out that the content and views in this next portion of the webcast do not necessarily represent the official policies of the Office of Adolescent Health or of HHS. I'm now pleased to turn things over to Julie to learn more about their exciting efforts to support adolescent health in Minnesota. Julie?
Thank you, Evelyn. So, Minnesota likes to play tag, and today I will share with you how we are doing that. In Minnesota, we had a good foundation for how we wanted to support adolescent health. We had the roots and a good place to start. We wanted to learn more from our partners around the state, so we connected with our adolescent health champions and young people across Minnesota to hear their needs, ideas, and values. Through our conversations, we noticed 10 themes that continually rose to the top and were clear priorities for those working with and on behalf of young people. Early on in our process, we learned that OAH was also working on an adolescent health initiative. When we connected with them, we learned that our 10 priorities lined up with the 5 essentials for adolescent health that they were working on. This was reassuring to us, knowing that the direction that OAH was taking was also one that resonated in Minnesota. So we decided early on to align our priorities with these essentials for a few reasons. We wanted to create a unified voice for adolescent health. If we are speaking the same language and aligning our efforts, it will only help to strengthen the adolescent field nationwide. We were already on the same page, and we felt that TAG is very innovative, exciting, and a really good tool. Finally, it gave us a practical way to organize all of the feedback and the material that we had collected from our partners. All of this really made sense. So today I will cover the Minnesota Department of Health Adolescent Health Strategic Planning process, which we call the Minnesota Partnership for Adolescent Health. I'll talk about our process, our priorities, and our call to action. First of all, I want to talk to you about our approach to adolescence in Minnesota. We believe in adolescenthood and giving time and space to this period. Gisela Konopka of the Konopka Institute of the University of Minnesota says adolescence is usually described as a pre or in-between stage between childhood and adulthood. It is often one that is seen as a time of turmoil as it goes from the protected state of childhood into a state of independence of adulthood. She preferred to see adolescence as a significant state in itself, an adolescenthood, if you would, with new experiences and strengths, and not just a period of strife and problem. So we believe in adolescenthood and giving it the time and space that it deserves, and the need for growth and development. I really like this photo of the rickety bridge, because I believe that that can kind of be, illustrates the journey from childhood to adulthood. It's a bridge that's scary and exciting. There may fall through some of the cracks, and there's different ways of getting across the bridge. But ultimately, you'll get to the other side while we're on our own journey of adolescenthood. Our adolescent health goals are to improve the health and well-being of all youth and young adults ages 10 to 25. We define adolescents and young adults as the ages of 10 to 25 based on what we now know about brain development. So what guides us is we want to build and maintain strong partnerships with other state and local public health agencies, youth-serving organizations, and professionals, providers, schools, policymakers, our young people, and places of faith, and others interested in the health and well-being of adolescents and young adults. This plan is intended for our public health leaders to work within their communities. As I mentioned before, we had the foundation and the roots of what we wanted for adolescent health in Minnesota, but we wanted more. So we engaged on a statewide initiative to connect with our partners and our adolescent health champions in Minnesota. We ended up with 45 listening sessions, 4 regional meetings, and we heard from 323 adults and 139 youth. What we learned about is that Minnesota is very passionate and believes in their young people. In these sessions, we talked about what is adolescent health, what is working, what are our barriers, what do we need more of, and my favorite question, if the sky was the limit, what would adolescent health look like in the state? Through this process, the vision became Minnesota is a place where all young people thrive. The purpose of our vision is to engage and motivate, to keep people focused on the big picture of what we want to accomplish and the direction that we're going. Our approach to this is we like to use the being, belonging, and becoming. It is our responsibility to support and guide Minnesota youth in the healthy development. Being refers to the developmental goals of defining who I am. This includes the physical, psychological, and spiritual selves. Belonging refers to the finding my place in the world, and this has to do with a young person's fit with their environment, their physical, social, and community environments. Becoming refers to achieving my personal goals, hopes, and aspirations. So being is focusing on ourselves, belonging is how we're going to fit and work within our world, and becoming is what are we going to offer and give back. This requires a focus on wholeness and wellness and seeing Minnesota youth as at promise with an opportunity rather than at a problem or at risk. So as I mentioned before, Minnesota believes in our young people, and we have strong roots. We are building this project from the ground up and including all the things that we want to help our young people thrive. So I'm going to talk now about what our 10 priorities are. We want to surround our young people with adults who understand youth development and positive connection. We want to support our parents and caregivers to provide the supportive foundation for young people's health and well-being. We want to partner with and create supportive schools to ensure students are engaged, connected, and learning. And we want to ensure our communities are a welcoming and nurturing place for all young people. We want to improve the responsiveness of physical and mental health care for young people. And we want to strengthen and create the effective governmental systems, policies, and programs that are designed to support the health and well-being of young people. We want to increase the opportunities for youth leadership and engagement to actively influence the issues that affect their health and their development. And we want to improve the opportunities for young people to engage in out-of-school time activities that support positive, healthy development. And finally, we want to address the social determinants of health and create a health in all policies approach. And we want to recognize and respond to the diversity, individuality, and unique circumstances of young people. Together, we feel these priorities are going to help our young people thrive in Minnesota. So as we know, TAG had good things going, and so did Minnesota. And so we wanted to combine our 10 priorities with their 5 essentials. And this is what it looks like. So in the larger white squares, those are the 5 essentials of TAG. And then in the colored lines beneath it are the Minnesota priorities. So you can see how they all align very well. And this is what it looks like. So if we go a little deeper, this is what the plan is going to look like as we roll out and create our products with it. You'll see on this page that you have the access to high-quality, teen-friendly healthcare. That is a TAG essential. And then you'll have the TAG response, the national response for it. Underneath that, you have the Minnesota response, what this looks like in our state. And then underneath the Minnesota response, you'll have each of our priorities that fit. And then there'll be room for our communities to go one step deeper and have the community response. So we have the national response, the state response, followed by the community response. It will be an interactive toolkit for our partners. And then we'll go deeper. Each priority will have its own page that goes deeper in explaining what we mean by this priority. We'll include some data that supports the need, to include action steps, and Minnesota examples and resources. Each of our priorities has 4 to 8 action steps that gives ideas of how we can put this priority into action. Then we have a website which is still being created, and on that we'll have examples of what these action steps look like. We'll have contact information, resources of who, how, and what it can look like. And in keeping with honoring the Minnesota voice, we tried to highlight the great work happening here, and in some cases we also highlighted regional or national initiatives. In addition to the priority pages, we will actively highlight priorities and push them out on our Minnesota Partnership for Adolescent Health listserv. We will host webinars highlighting the work that is being done and provide TA for how to implement these strategies, what it looks like in a specific community, or connecting to those in the state, region, or country that are also doing some of this work. So you're it. We have TAG, the national response to adolescent health. followed by the Minnesota Partnership of Adolescent Health. And now we are launching this back into our communities and getting the Minnesota community response to adolescent health. So our next steps are launching it back with our partners and the communities that participated in our listening sessions and helped shape this plan. We're building the website, and we're working with our local public health and tribal communities to identify priorities and determine what these priorities would look like in action within their community. We want to keep this fresh, current, and alive. So come join us. If you'd like more information on the Partnership for Adolescent Health or would like to join the listserv, please email this address below, health.adolescenthealth@state.mn.us, and I will gladly add you to our partnership. And I wanted to say thank you and that we love to play. And I wanted to especially do a special call out and thanks to Kristen Nietzel and Glennis Shea from the University of Minnesota for offering the guidance, support, and technical assistance for us to work on this plan.
Thank you, Julie, for sharing your story with us and, more importantly, for your hard work and dedication to promoting adolescent health. We'd like to take a few minutes now to ask some additional questions. So first, can you tell us a little bit about how this effort changed your thinking about adolescent health and how communities can best support young people?
Yeah, so when deciding our approach to this project, we discussed creating a topic-based plan like teen pregnancy prevention or chronic disease or mental health. But we realized that to really work on adolescent health, we needed a multi-level and multidiscipline approach. We needed a whole child, whole community, and whole system approach to adolescent health to wrap around our young people. So this sounds wonderful, and it is, but it's a very daunting approach to a project of this size. To really support our young people, we need to look at where and who and what are the touch points in their lives that are both big and small. We need to work outside of our silos and include authentic, supportive partnerships. Partnerships that keep young people in the center and allow supports to do what they do best, and keeping in mind our shared goal, which is to help young people thrive. For example, schools have a primary goal of academic success and graduation. Health has the goal of, well, health and preventative steps to ensure health across the lifespan. Supporting something like school-based health centers meet both of these goals. We take away the barriers to health services by providing a clinic where the young people are located, which is removing our access barriers. This creates a healthier student body and allows students to meet their health needs, returning to class quicker and performing better in school towards their success. This is a win-win by two separate stakeholders that keeps the well-being of the young person as the main focus.
So what was the most challenging about engaging stakeholders and community members in this effort, and what strategies worked best for you in overcoming those challenges?
It is very important to honor the relationships, both new and old. And so we are asking for time from people and groups, and we're asking for their voice, input, feedback, experience, and knowledge. And it's important for us to keep in mind what are they getting from us in return. We want this to be a give and take experience. So, and it cannot be a one-way relationship of the state taking and not giving back. Authentically engaging our partners acknowledges this and spends time keeping partners updated on the project, and we circle around and share the priorities, the action steps, and the examples back with our partners. We offer TA and guidance when appropriate, and we keep in mind that we are creating a plan with our partners. And so this takes time and a lot of attention to the nuances of relationships. Engaging stakeholders goes beyond this project, and because it is setting up a partnership for future work in the state for supporting adolescent health. This is not just a one-time engagement process. It's just the beginning of a long-term relationship.
I recommend to other states that want to embark on a similar effort. Are there some do's and don'ts?
Yeah, some of the things we learned about this project were we do create a team to work with and the resources to stay focused on the project. You want to create a team that's diverse in its members and represents a variety of stakeholders. And it's important to branch outside of the usual suspects, and it's okay to add new members to your team as the project moves forward. I think it's important to authentically engage our stakeholders, including and especially with young people. Then it's really important to honor their feedback and voice that you do receive. We truly hope and believe that our partners that contributed to this project will see and hear their voice in the priorities and the approaches supporting adolescent health. It's important to make sure that you have a process to organize all of the feedback and digest the information in a way that exposes themes and ideas and helps to make sense of all of the feedback. This was where TAG was especially helpful and offered a great framework to help us organize and make sense of all the feedback we received. That was something that we were pleasantly surprised and a bit overwhelmed with all of the input that we had gotten. Another thing I think it's important to do is to share back the plan with the communities that helped to shape the priorities and give voice to the project. We do not believe that this is a Minnesota Department of Health plan. It's Minnesota's plan that MDH is holding and organizing and helping to move adolescent health field forward. It is and to make sure that our young people in Minnesota are thriving. And those are some of our lessons learned that we had from this project so far.
Thank you so much, Julie. On behalf of the Office of Adolescent Health, I want to thank you for joining us to learn about OAH and TAG and to hear about the wonderful work going on in Minnesota. A special thanks to Julie Nietzel Carr for sharing their work with us today. The TAG effort continues, and we invite you to get involved and spread the word about TAG within your professional networks. Here are a few of the things you can do. You can explore the website. I encourage you to check out the TAG playbook. You can join TAG and get email updates. You can watch one of the TAG Talks videos with your colleagues, and I encourage you to notify your colleagues and grantees about TAG. You can encourage your organization to use TAG action steps and resources. You can blog about TAG, and there are sample text on our TAG toolkit. You can ask questions, share ideas, and stay in touch. I encourage you to use TAG social media tools to reach some of America's 42 million teens and the adults who care about them. And you can do this at #42mil. And here are some ways to connect with us.
You can connect with us through our website, through Twitter @TeenHealthGov, and also through our periodic newsletters. Recently, our email provider changed. So if you've received these updates in the past, please go in and check to make sure you're still receiving the messages you want to receive. You can also check us out on our YouTube channel, and I want to thank you for joining us and giving us the opportunity to share TAG and a great example of TAG in action with you today.